Next, we've got Dr. Susanna Pecci. She describes herself as a GP, an innovator, and a CPTSD survivor, which is complex post-traumatic stress disorder, mental disorder, and, again, most excitingly for me, a samba reggae drummer. And she's not just a casual player, because she was part of the Platinum Jubilee celebrations. She played in the Salvador Carnival this year, and she shared a stage with Sam Ryder at Victorious Festival. So hopefully there's some footage of this somewhere, because we need to see this. But it's a very powerful talk today. So here to tell you why trauma is everyone's business.
Trauma is everybody's business. Why? Because when you work with people, you work with trauma. The image that tends to come to mind when people hear the word trauma tends to be something about combat or war, but there's so many causes of psychological trauma. Anything from bullying to receiving a life-altering medical diagnosis to child abuse. And unfortunately, the stats show it's really common. 1 in 4 women report being seriously sexually assaulted or raped in adulthood. And 1 in 6 children report being sexually assaulted. And 1 in 5 children grow up in a household with a perpetrator of domestic abuse. It's not just the trauma that's the problem. It's not just that traumatic event. It's what happens inside that really causes the lasting impact. You see, that initial stress survival response is just that. It's to keep us alive. It's to make us survive. And it's an entirely normal response to an abnormal situation. But when the brain and body gets stuck, when it can't regulate its nervous system, that's when the problem occurs. You see, that's when that acute stress becomes chronic stress, and that chronic stress leads to inflammation. And it's inflammation that leads to long-term problems and shows up in the brain and body in anything from anxiety disorders and depression to pelvic pain like endometriosis, or bowel issues like heartburn or irritable bowel syndrome, and even massively increases our risk of heart disease and cancer. And it also impacts our beliefs and our behaviours, impacting how we communicate. It's the thing that underlies imposter syndrome or people-pleasing behaviour or struggling to say no and having problems with boundaries. So imagine if we actually really acknowledged the prevalence of trauma and really acknowledged the impact of psychological trauma, and that we took time and made space for practices that helped calm our nervous system and help reduce inflammation. Like really pausing to listen and connect with someone when we say, "How are you?" Or really taking a proper break and eating our lunch mindfully. Or going outside and stretching our limbs and going for a walk in daylight. Trauma impacts all of us. And the sooner we acknowledge that, the sooner we can change our collective well-being and actually also improve our productivity and creativity. So I'm curious, what are you going to do to bring a trauma-informed perspective into your corner of the world? Thank you.